Multiple sclerosis (MS) represents a multifaceted autoimmune disorder characterized by the progressive destruction of myelin and oligodendrocytes within the central nervous system, CNS. It predominantly affects individuals in the prime of their lives, most commonly striking young adults between the ages of 20 and 30, with a notable predilection for women. The etiology of MS is complex, with genetic factors playing a role, notably the association with the HLA-DR2 genotype, and environmental influences, as it is more frequently observed in regions distanced from the equator. Clinically, MS manifests as a dynamic interplay of relapsing neurologic deficits followed by periods of remission, indicative of multiple lesions occurring in both time and space within the CNS. These manifestations encompass a diverse array of symptoms, each reflecting the specific regions of the CNS affected. Notable symptoms include blurred vision due to optic nerve involvement, vertigo, and scanning speech mimicking alcohol intoxication as a result of brainstem lesions, internuclear ophthalmoplegia arising from involvement of the medial longitudinal fasciculus, hemiparesis, or unilateral loss of sensation typically associated with cerebral white matter lesions, and lower extremity loss of sensation or weakness implicating the spinal cord. Moreover, autonomic nervous system dysfunction frequently leads to bowel, bladder, and sexual dysfunction, further adding to the multifaceted nature of the disease. The diagnosis of MS is primarily reliant on a combination of clinical findings, neuroimaging studies such as magnetic resonance imaging, MRI, and cerebrospinal fluid analysis obtained via lumbar puncture. MRI scans often reveal characteristic plaques, indicative of white matter demyelination, while lumbar puncture findings may include increased lymphocytes, elevated levels of immunoglobulins with oligoclonal IgG bands detected on high-resolution electrophoresis, and the presence of myelin basic protein. Gross examination may show gray-appearing plaques in the white matter, further corroborating the diagnosis. Management of MS encompasses a multifaceted approach, with treatment strategies aimed at both managing acute exacerbations and slowing disease progression over the long term. Acute attacks are typically managed with high-dose steroids to mitigate inflammation, while long-term treatment may involve the administration of interferon beta, which has been shown to exert a modulatory effect on the immune response, thereby slowing the progression of the disease and reducing the frequency of relapses.